Hi, I'm Antony P. from Uni-edit. In American news, we use a lot of technical terms when we talk about COVID. This story uses over 80 common terms that you'll hear or read in the news about the global pandemic. Did you know you can slow down the speed on YouTube by clicking in the settings below? Listen closely to my story and write a comment below with the words you found most confusing or difficult. I will read your comment and reply. Let's begin. 2019 was an incredible year for me. I was teaching English in Japan and was able to take a vacation to Taiwan in April. It was very hot and I arrived with some flu-like symptoms, but I hadn't caught a disease or anything, so I was still able to have such a good time. I stayed in Ximen and I fell in love with Taiwanese food. Later that year, I was able to travel unrestricted all around Asia even more, and I ended my vacation with a full month in Taiwan. The antivirus on my computer protected my personal information while I traveled, which was a plus. In December of 2019, I traveled back to my hometown in Cincinnati, Ohio to celebrate Christmas with my family. And that's when things started to change. News stories about an outbreak of a new sickness in China quickly took over our televisions. Fear, uncertainty, and panic began spreading around America like wildfire. The sickness was caused by a coronavirus. This new coronavirus was named SARS-CoV-2 to differentiate it from SARS from 2002. The virus caused some infected people to have severe respiratory symptoms. Images from Italy's outbreak became global news, and the severity of the disease became known. As other countries started to declare local epidemics, any sick person started to believe that they had the deadly pathogen and quickly became worried. In March of 2020, Americans went under lockdown. Businesses were shut down by the government and curfews were put in place by the local authorities. At that time, America's infection rate was accelerating towards 20,000 new cases per day. New data was being released by various sources telling us that the COVID-19 mortality rate was as high as 6%, and that the elderly and those with pre-existing conditions were at the highest risk of severe illness and death. With a death rate that high, the spread of the virus shouldn't have been ignored. Then, our stock markets crashed over the course of 3 days as COVID-19 became classified as a global pandemic. The US had clusters in New York and Los Angeles, with COVID-19 patients filling up the local hospitals. Many people were buying and wearing masks so they didn't catch the virus. In my city, people were buying tons of toilet paper and cleaning supplies. This caused supermarkets to run out of those products in just a few days. This shortage caused more panic in the local populations as the spreaders brought the disease into the isolated countryside. Over the next 9 months, America's COVID-19 cases exploded, reaching 300,000 new cases per day on January 7th. While most of the world was taking the pandemic seriously, many Americans were not afraid of becoming sick and were not afraid of transmitting the virus to others. Many Americans were not self-isolating, and local governments did not have strict rules such as curfews and lockdowns. My brother, aunt, and cousin all caught COVID and had to home quarantine for 2 weeks while they were contagious. They think the virus was transmitted to them at a party with no social distancing. Luckily, they were not sick for long and didn't need any drugs or therapeutics to feel better. Fortunately, widespread availability of COVID-19 vaccinations started to become available to Americans in early February of this year, even though coronavirus infections would still be a concern for a long time. Many of the vaccines reported more than 90% effectiveness against contracting COVID-19 and reported a huge reduction in hospitalizations. Restrictions would soon loosen as more became immunized. My sister and I received our first shot in late March of 2021 and got our second jab in the middle of April. My family all got their doses and were immunized before the summer. With our new immunity to the virus, the end of the pandemic seemed to be near, but many Americans had distrust in the medical systems and refused to be inoculated. It seemed they would rather have the coronavirus disease 2019 than get the injections. I still don't understand why catching the disease didn't scare them. In the US, currently, as of August 2021, there are no mask mandates, lockdowns, or curfews, and people are living their normal lives whether they are vaccinated or not. People are traveling, going to restaurants, and watching movies with no mask and no vaccination. Furthermore, there is no evidence that herd immunity is being achieved. This arrogant behavior has caused US daily positive COVID-19 tests to skyrocket again. There are over 150,000 new COVID-19 cases every day. Some of this increase is due to the widespread Delta variant being more infectious. As the number of recovered cases gets close to 200 million people and the case fatality rate continues to decline, I hope Americans start to be more responsible and increase their vaccination rate so we don't risk the health and safety of our most vulnerable people. There are antivirals that help with recovery efforts, but vaccinations are the most effective in preventing disease and death. I hope other nations can learn from the mistakes that the US has made in response to the COVID-19 pandemic and can keep their citizens safe. I believe that the increasing amount of vaccine technology will be crucial for controlling epidemics for coronavirus across the world. And there you have it. That story used over 80 COVID-19 pandemic-related terms. Congratulations on making it this far. I have a question for you. Which word did you find most difficult from today's lesson? Let us know in the comments below. That's all for today. Please stay safe, and I hope you are able to get your vaccination or booster shot soon. If you enjoyed this free content and want to support me in this channel, please like and subscribe, and I'll see you again soon.